you're getting shark teeth and you're drilling down your teeth, and it's kind of wild what you see on social media. We don't do that.
When you look at Tom Cruise before his teeth were done, he had like one central incisor.
When the patient comes to you and they're like, I have wrinkles here, or I want to treat this, but I only want Botox in this area.
You can build a chin, you can build a mandible, a jawline, but if they don't have really good dentition back there, there's really no support.
So we look at it in a holistic, full picture image. What will make this patient happy in terms of what they need?
I try to brush for 2 minutes, and that way the actives are actually working.
People used to get the really chunky white veneers, and now they want that seamless, natural look that you can't identify.
We use Botox off-label to relax the masseters, to like slim out the lower face.
It doesn't really do justice for the entire smile because the smile affects the entire face.
How do you use things like, I've heard of golden ratios of teeth, or do you just really go by like the individual person?
So both. I think aesthetics in general goes through stigmas.
I'm Dr. Anthony Rossi, and this is Give Good Face, a podcast focusing on skincare science, and how to maintain and shape a healthy lifestyle. Welcome back to Give Good Face. I'm Dr. Anthony Rossi, and here with my good friend, Dr. Clem, who I recently had the pleasure of touring his office at APA Aesthetics, which is an amazing dental practice. They're not just a dental practice, it's like the next future of dentistry, including cosmetic dentistry and aesthetic dentistry, which I want to, take a deep dive with you, because in our world, we deal with skin, hair, nails, the face. But in reality, like the teeth are so important for how you look and how you feel. So just tell us a little bit about yourself, the practice, and how'd you get into cosmetic artistry, dentistry?
Yeah. Well, thank you for having me.
Yeah,
Very excited to be here. And thank you for coming to the practice. It's special.
It's amazing.
It's been around for a while. It was started by Dr. Rosenthal, who is a legend. And then it was taken over by Dr. Appa, and he just exploded the practice. We have an office in Dubai, in Miami, in LA, and it's just become the standard of dentistry, of aesthetic dentistry. So if you say Appa Aesthetic, you're getting gold standard of care for cosmetic dentistry.
Amazing. I was in the one in New York,
which is the best one.
Which is
I might
beautiful.
be biased, but it's the flagship one.
Okay.
And it is in my opinion, the best one.
Okay.
Yeah.
Nice. And so you went to dental school, and then how do you make this transition now into the world of cosmetic dentistry? And what does that mean?
Right.
Yeah.
It's been a journey. So I moved here when I was 18. I grew up in Abu Dhabi. I did my undergrad in bio and chem. I always wanted healthcare. I just didn't know what, I took the MCAT, didn't do great. But then I got my master's in public health from Mount Sinai. And I worked as a consultant in business healthcare for like a year and a half.
Okay.
And I was like, I don't know if this is sustainable for me with all the traveling. So I applied to dental school. I went to NYU, did my residency at Yale. And then I was working in a small private practice in Union Square. And I was going on a trip with my friends to Boca, which is so funny because I was in Boca, same hotel last week. And I was like, 3 years ago, I got a text. I got off the plane, I got a text. And I have a really bad habit, which I've changed.
Is that not wearing sunscreen? Because I saw your Instagram.
Not wearing sunscreen is one of them.
We're going to change that though.
I got so much hate for that. My other bad habit is that which I think is fixed for the most part. I don't save numbers on my phone.
Okay.
So I just remember, we're working on it.
All right.
So I got this random text, hey, can you come over at 4? I'm like, okay, it's a Tuesday.
Yeah.
Weird.
That's a run-of-the-mill text for you.
Yeah, I was like, okay, who's this? It was Dr. Appa. I came in, he's like, I want you to join the practice.
Wow.
I joined 3 years ago. March is actually my 3-year anniversary.
Happy anniversary.
Happy anniversary. And it's been great. And it's really, it changes being part of this practice changes your perception of what dentistry is.
Okay.
And it's not your regular filling, which it includes it, but you're looking at a whole picture of what dentistry is and what it inspires you to be.
Yeah. And so I think when someone thinks about cosmetic dentistry, their minds go to veneers, right? Mm-hmm. Right away. Some now may go to Turkey, that whole idea of like going overseas to getting these veneers. And there's a lot of images online and on YouTube about like what you have to go through to get this, but you've changed my whole viewpoint of it. And I'll share some photos that I took on social, but it's really changed my whole idea of what they actually are.
It's kind of crazy the misconception of what dentistry is and what veneers are. Like you're getting shark teeth and you're drilling down your teeth, and it's kind of wild what you see on social media. We don't do that. Like, it's simply, we don't do that. We always want a conservative approach. We want to do what's best for you, form and function and aesthetic and all that. But we are conservative. So when we're telling you to do 10 teeth, that's what our recommendation is. But that doesn't mean we only do 10 teeth. We do 2 teeth. We do 1 tooth. We do a full mouth rehab. Whatever is best to get you the result that you need, which is the same in your case, right? When you're when the patient comes to you and they're like, I have wrinkles here, or I want to treat this, but I only want Botox in this area. You're like, I don't know if I could do that, right?
Yeah.
So we look at it in a holistic, full picture image. What will make this patient happy in terms of what they need?
Mouth rehab, smile makeover, turkey teeth.
Turkey teeth are a thing.
Yeah.
And you can spot them a mile away. Like if I can see that you have veneers, you should change your veneers. And I tell this to my patients all the time. If someone compliments your veneers, come back and let's have a conversation. They should compliment your smile, because good work is invisible.
That's amazing.
That's how it is.
We say that about also dermatology too. Like really good work, you kind of don't know.
Exactly. Yeah. And that's the standard, right? So I got a hair transplant a few months ago, and Turkey is the place to go when you need a hair transplant. I did my research and I was like, I don't know if I want to do Turkey, even though I'm sure they're great. I did my research. I'm like, healthcare and aesthetics is not where I want to short time my
exactly.
I'll like skip coffee for a few days if that's what I need to do.
People don't realize like if you skip some coffee every day, like how much money you save.
Right. But I'm not like, going to cheap out on a medical procedure.
Totally.
And the same thing goes with dentistry. Yes, there's always cheaper options. We're not the cheap option. We're the best option.
Yeah.
And that's
your hair looks great. Your smile is perfect.
Dr. Ben Paul did a great job. So
amazing.
Shout out.
You should have him on here one day. Yeah. I love that. And I think there's less of a stigma around veneers now. And, the idea of a smile makeover, it really resonated with me because it can really change someone's, overall appearance of their face.
100%.
Yeah.
100%. To become part of our practice, you come in for an aesthetic consult, and whether it's 2 teeth, 10 teeth, 4 teeth, full mouth rehab, whatever it is, once we do that cosmetic part of it, we become your dentist. Like I'm doing your general dentistry, you're getting your cleanings there. If there's a filling that needs to be done, we do it.
I've heard of golden ratios of teeth, or do you just really go by like the individual person?
So both.
Okay.
But to touch base on the stigma, I think aesthetics in general goes through stigmas, right?
Totally.
Like people used to get nose jobs all the time, and now it's different. People used to get the really chunky white veneers, and now they want that seamless, natural look that you can't identify. So it goes through up and down. And I think people have now embraced veneers. Everyone wants a beautiful smile because people are looking at your eyes and your smile. And oral health right now is really at its peak.
Totally.
How do we design it? It's really like you come in, we do a consult. I give you my full undivided attention for an hour, and we sit down and talk about expectations and outcomes and desires. And based on that, you combine the science, the golden ratio, the golden proportions with what the patient needs and wants, and you come up with a treatment plan. It's not cookie cutter, and that's what makes us different. So it's not everyone that goes to APA Aesthetic is getting 10 veneers. Some people get 2, some people get 4, some people are not the right fit for us. And that's where we are, where we're able to say, I will take on your case, or we're not the right fit. But we have our own labs, our own ceramists. Everyone is trained to the highest standard. So we're able to kind of really customize the treatment start to end to tailor it to you.
I mean, watching those ceramists layer on the layers of porcelain with these fine,
powders.
Powder.
It's wild.
It was wild. It looked like a Venetian, artist like laying on plastic.
And then they bake it and it comes out like teeth. And you're like, what's going on here? Yeah, what kind of magic are you guys doing?
Yeah, seeing behind the curtain and seeing how it's made really gives you an appreciation of the cost that it takes
and
to actually create that
effort.
Yeah.
And you're taking powder and making it into teeth.
Yeah. That are durable and strong.
And you can use them every day for the next 15 to 20 years.
Wow.
So it's really the perfect recipe of artistry, function, form. The thing is, you want to forget that you have veneers 2 weeks after you insert them, or by the time you get a first cleaning, right?
Yeah.
Like I have 12 veneers on top, and I'm not aware that I have 12 veneers. Like when you first get them, you're like, okay, this feels different. But it shouldn't. After a couple of years, everything adapts, right?
As someone who's had braces in high school, like anything is better than that.
I've been there, done that. I had it for 3 years.
Okay.
So I had a missing congenital lateral, which is pretty common.
Yeah.
So I had the space done. I had an implant. They closed it. Yeah. So.
Wow. Well, actually, when I'm bored, which is not often because there's just so much to do, I sometimes look at old, photos of movie stars and look at their old teeth beforehand. Because like if you dive deep into the internet and the dark web, you'll find these old photos of them and then see how their teeth have changed.
Crazy.
Or how they improved that. And like their whole face is different.
100%.
I mean, they've gotten probably other work
Who's
done
your
as well.
celebrity perfect smile right now?
Well, when you look at Tom Cruise before his teeth were done, he had like one central incisor or something.
Right.
I think it was a congenital.
But that's also, you picked the most drastic one.
And then you look at his after and it's just like, wow, his whole face really changed.
Yeah. And the perception of what the perfect smile is changes also.
Yeah.
So like 20 years ago, Julia Roberts had the most beautiful smile.
Sure,
Everyone said she is, and I love Julia Roberts. Right now, patients come in wanting Margot Robbie.
Oh, wow.
She has the gold standard of dentistry, right?
That's so interesting.
Yeah. So it changes, that perception changes, which is so funny because I was talking to my friend the other day and they're like, oh, whose teeth would you change? Oh, you should change this person's teeth. I'm like, I would never, because there's also patients or people or celebrities that you will know their smile, who they are from their smile. So these are cases I would never like touch, right?
Totally. Yeah.
Because they're so
signature.
distinct.
Yeah.
Exactly. Yeah. Like you don't, yeah.
Yeah. People come in asking to be a Kardashian, but I don't think they ask for their teeth.
Correct.
Yeah.
Right. So you're like,
it's not as memorable.
I can do as much as I can. Right. Yeah. But like you, with all the cases, you want to preserve the identity of the person. Like I want to give you a nicer smile, a more beautiful smile that functions well. But I also want to keep you who you are, where you look in the mirror and you're like, this is my smile. This is me.
That's really interesting. Another interesting point that we had talked about when I was in your office is that the wowness of when you first look at someone who has had veneers, or when they actually look at themselves for the first time with the veneer, in our line of work in dermatology, people sort of remember what they've looked like in the past.
Mm-hmm.
When they were younger, they might have had a fuller face, they had more facial fat, they had less wrinkles.
Yeah.
So they have this idea of what they look like young. But in your case, you're creating a smile that they've never had before,
right.
Which is so interesting, because then when they look at that for the first time, are they shocked? Are they like scared? Or what is that reaction?
Really good question. Because the wow factor and I've seen it where like, people just put up their mirror and everyone's like crying. And I'm like, I don't know how true that is, because we just gave you something that is so different, but also so you.
Okay.
Because you're in temps, and the first look you're looking at is your intemporaries. It's not the finals.
Sure.
So everything is not perfect. We're using it as a guide. We're working on it, So the initial wow factor is, I think, not realistic.
Mm-hmm.
I tell patients, it's same in your case, or when people get a nose job, or when people get any kind of cosmetic surgery, people have to heal.
Yeah.
Wait 3 months, let the tissue drop in, hug the teeth, let everything adapt, your muscles, everything will kind of fall where it's supposed to be, and then reassess. But it's human nature. I mean, when I got my teeth done, first thing I did was hold up the mirror and I was like, oh my God, But I know what I was expecting.
Yeah.
So the best way to kind of look at it before and after, and the afters that we post are usually 3 months after.
Okay.
When everything really heals and you get a full image and a full picture, because you want to be fair to the smile and the teeth. And we're posting really close-up images of the afters and the befores. And it doesn't really do justice for the entire smile, because the smile affects the entire face,
Definitely.
And like you see it with your patients when they do veneers or not. I mean, my biggest referrals are my derms.
Oh, no.
Because they're so close up with their patients.
Mm-hmm.
It transforms the entire face, like the lower third of the face. When it collapses, we build it back up, less wrinkles. It's like a mini facelift almost.
That's a great point too, because, when we look at someone and we are assessing their lower third of their face, if there is some sort of protrusion, in the mouth, they need to really build that up, because it's going to help the overall architecture or the foundation of the lower face.
Exactly.
You can build a chin, you can build a mandible, a jawline, but if they don't have really good dentition back there, there's really no support.
Correct.
Yeah, so they should see you first.
They should see,
Yeah.
I mean, I think it is recommended to do your dentistry first before a facelift, because you can't really tug on the face afterwards anyways, and you want to it's the groundwork for a facelift.
Yeah. Because you will build up anterior projection in some respects.
Correct.
That's
so
great.
the surgeon will come in and play around it. And we have a great network of surgeons that we work with. We have a great network of orthodontists. So when patients come in, they really feel safe and secure. And I think that's the most important thing, is that they come in, they trust you, you earn their trust. And I tell them, this is what you need to do. And they go with it and it's the same thing when I go to get my procedures done with whoever. They tell me, this is what you need. This is your realm. I will trust whatever you say. That's why I'm here. So when patients are looking for the perfect dentist, for the perfect derm, for the perfect plastic surgeon, I mean, I tell them to go to Melinda, the beauty broker. Like she'll guide you, but you have to have trust in your provider. That's the most important thing.
And that's what I try to do here. I try to bring on people who are just top of their game, experts, to really discuss like the ins and outs and the nuances that I don't think patients always appreciate, because there's a lot of stuff going on in the back, right? Like, your years of knowledge, your years of experience, and like how many smiles you've done really helps to shape the next one going forward.
100%.
So there's always a sweet spot of, when you're at the best.
It's a sweet spot of expectation with trust, with reality, with also with my limiting factors. There's occlusion and form and function that we can't forget. It's not just aesthetic. It's oral health that we have to like take care of.
And honestly, smiling, is linked to oral health, right? I mean, if you have great teeth, like people are going to resonate with you because they're going to, think that you're healthy to begin with.
I might be biased, but a good smile changes your life.
Sure.
It really does. Like it inspires you to live life to the fullest. And Dr. Appa says this all the time. It's not about the smile. It's about the life that the smile inspires you to lead. And we see this in patients day in, day out. When they come in for their 3 months recall, some people got married, some people got divorces, some people, have new boyfriends.
Yeah.
It inspires you to really just and this is why when we say dentistry is linked to your health, is because you're just more in charge of your health when you really feel the power of a smile. Yeah. And I felt it. I mean, I had 12 veneers done on my upper teeth 2 years ago, and they feel natural. They feel like my own teeth, but it really inspires you to like really give it your best.
Yeah, I mean, you're smiling more, you're attracting more people.
Correct. Confidence. Yeah. A smile is also like, aesthetics aside, oral health is linked to, so there's so much scientific research about how important it is to take care of your smile, of your oral health. When you have a nice smile, you're more inclined to take care of your oral health.
Which I like what you said, because when someone becomes your patient, they become your patient sort of
for life.
And
they're stuck with me.
Yeah. It's a great, because you're also dealing with, their teeth health, their oral health, and like, that's great to be able to.
If there's a lesion, we send you to our network of oral surgeons. If you need a root canal, we're sending you to our endodontist. If our orthodontists, like.
Because there is some upkeep that you have to do with veneers, right? Like you still have to brush your teeth.
You still have to brush your teeth, I would hope. You know, if you have to floss, wear your night guard, come in for your cleanings every 3 months. I think it's outdated to say come in for your cleanings every 6 months. In general, I don't know how
you
kosher.
Told me that,
how kosher it is to say that, but it is what it is.
Yeah.
I think you should be getting cleanings every 3 months. That should be the new standard of care, whether you have veneers or not. Because no one's really flossing as they should, as much as they want to.
I confess.
Like
I'm a horrible flosser. Yeah.
And like it's just better. See your dentist for 3, and you have 2 of them covered by your insurance. If that's the reason why you're going twice a year, just pay for the extra 2.
Yeah, for sure. I wish someone would come up with a better way to floss, but they really haven't, right?
I mean, it's pretty simple. Just wrap it around the. You can water pick.
I have a water pick. I have 2 electric toothbrushes. I have an Appa toothbrush.
So you're ready. You're set.
I have all these, I first put on my face wash. I let it sit on. Then I brush my teeth. I floss. I water pick. There's a lot going on. Yeah.
So that walking through your routine is you face wash and then you brush and then you floss?
Yeah. So because I like to use my face wash that have active ingredients, I want it to sit
Which
on.
we're going to try.
So I always tell people, if there's an active ingredient in your wash, don't like put it on and put it off, because it's like washing with water. So like put it on, and then I tell people to brush their teeth, basically.
I like that.
At least brush for 2 minutes. Like,
okay, I like that a lot.
I try to brush for 2 minutes, and that way the actives are actually working. And then, but now I've been introduced to fluoride, like concentrated fluoride toothpaste, but now there's something like hydroxyapatite.
Fluoride is a sensitive topic, right?
Okay.
Some people want to have it in their toothpaste, some people don't. We have hydroxyapatite in our toothpaste. It remineralizes your enamel. It helps maintain the integrity of your teeth, and it's great for you. And this way, it also if you're fearful about fluoride, you're still getting it from your water source, from your food, whatever your sources are, but it's not in your toothpaste, at least the ones that we give out.
And hydroxyapatite is part of the tooth itself, right?
Correct.
Okay. So it's sort of like you're remineralizing the tooth.
Exactly.
Okay.
Yeah, it remineralizes the enamel,
Yeah.
which strengthens it, so you're less prone to cavities.
Amazing.
Because you can still get cavities if you have veneers, right? And that's why you want to use a oral health routine that not only keeps it clean and bright and fresh, but also prevents you from getting cavities.
Because again, just for the listeners and the viewers, you are not shaving the tooth down to like a little spike. Yeah.
So to be really clear about this, because we get asked.
It's a misconception
every day, and I show patients preps and like, this is how your teeth will look like. But the real answer is it's case by case basis. If you need a crown, you are getting the tooth shaved 360. If you need a veneer, the front part of your enamel is shaved off very minimally. Our goal is to always remove the thinnest amount of enamel possible. And that we're not just saying that, but the reason is scientific, because veneers bond better to enamel. So you're trying to maintain as much enamel as possible for the integrity and longevity of the veneers. So our goal is not to shave as much as we want. So how we base how much we're shaving is on the form of the teeth, the alignment, if we're changing color, if we're changing shape, the bite we're changing it, we're raising it. So that all depends on how much we're shaving, how much we're keeping. But we don't go in and just prep the tooth into a crown.
Wow. So do you work in millimeters or like less than millimeters?
Like our perioprobe is a millimeter, and we're measuring everything in millimeters.
Wow. So it's super precise.
It's super precise. We have our loops on magnification 2.5. We're seeing everything in hyper detail. That's why patients are not super sensitive after getting veneers, because they still have their integrity of enamel.
You mean tooth sensitivity?
Yeah, because we're preserving enamel as much as we can.
That's really important.
Yeah.
See, we don't learn so much about teeth in medical school.
Why are we like the black sheep of the family?
No, I know. It's like a whole different world.
I know.
Yeah.
Also, NYU rolled out free tuition for med students, but not for dental students. I'm here to petition that dental students need free.
We have it at Cornell for med school, and I know NYU was like a pioneer for that, but I didn't know because that NYU dental school is expensive.
It is expensive, let me tell you, but worth it.
NYU, don't hate me. I went there for undergrad.
But it's the best in the country.
Yeah, I heard it.
It's the best thing. I will go only to dentists who went to NYU. I'm sorry.
Wow.
Yeah, I trust
pride.
them. I trust them, and I trust NYU, and we just opened our APA aesthetic unit there, and we have the Rosenthal wing.
Really?
We've
so you're teaching like the dental students now. Wow, a whole clinical education program just focused on veneers, aesthetics, and the veneers and the science behind them and the artistry behind them and the methodology to get to where, because it's a system in place that you learn at a young age and you're able to replicate it. And I'm part of our program there at App Aesthetic and at NYU is to kind of look at the broader picture. Okay. What does that mean? Yeah.
Broader picture meaning that when you come in, we're looking at your smile as a whole, because your smile is part of your face. It's how does it integrate into your facial features? And we're not looking at it as a single tooth by tooth. What am I doing to really elevate this smile in terms of health, in terms of aesthetic, and whether I'm implanting one tooth or 10 teeth, but I'm looking at it. What Dr. Calamia used to say, and he's one of the instructors there, pioneer. He taught Dr. Appa, he taught me. I mean, it's crazy. He says, start with the end in mind. So what do you have? What do you want to get to? You start and you work your way there. And when you're starting with the end in mind, you're looking at the picture as a whole. You're not looking at one tooth. And that's why when we're looking at post-op photos, you're looking at the whole smile as a big unit in the face. And I wish I could share more full face pictures because they just are transformational, really.
You probably see like a different, just also again,
their eyes light up.
Eyes light up.
Crazy.
The lower face projection,
it's crazy. The lower face, you're adding dimension to it. They look younger. The eyes brighten up. The cheeks are higher. There's less wrinkles. It transforms your entire face, and they're just happier. Mm-hmm. They're just happier, really.
Yeah, and if you're addressing, a lot of times we see masseter hypertrophy, people who grind their teeth so much. We use Botox off-label to relax the masseters to like slim out the lower face. But you can really change someone's lower face also by working on their teeth
100%.
Their alignment. Yeah.
But a big shout out to you guys for helping us out with the grinding and clenching because it's crazy how many people in New York just grind and clench. And like the night guard sometimes is not enough.
I've seen people like break their night guards.
I've seen like chew it through it. And I'm like, this is insane. I wish I had your masseter.
I mean, they probably should incorporate a therapist at some point.
I know, right?
Like, there's a lot going on.
A lot.
There's only so much we could do in a visit.
We know our limits. We know our limits.
But I did see a cool study where it showed that using Botox to relax the masseters also helped change the bite pattern. If someone was like really clenching or gnawing on one side, you could sort of tweak it by like relaxing their
You want to
masseters.
equilibrate the bite so you're hitting on both sides posteriorly at the same time. Just so you really like, you don't want to get abfractions or recession on one side because that's the only side you're using to chew or to grind or to whatever. You want it to be a little bit more symmetrical and equal. And I think this is why it's so important to have a relationship with a dermatologist, because they help kind of, or even when you have a very gummy smile, we do crown lengthening, we reduce it, but then we also have our limits. And this is where you guys come in and inject a couple of units here, drop the lip. It's hand in hand. It's a work of art and we're all working on it.
It's really amazing now that we're living in a world where you can really, these minor tweaks can really make such big differences.
Huge.
Yeah.
I mean, I have an insane frown line here that makes me look so angry all the time. And without Botox,
you never seem angry.
I know. And now I'm just like happy, but it's just a line here that a couple of drops of Botox do the trick.
It does the trick.
Yeah.
Exactly. Yeah.
And I'm a huge believer, whatever makes you feel good and look good, go for it.
Yeah. Because you do start to act differently.
100%.
Like the confidence, I'm sure you see people's confidence go through
100%.
the roof. Yeah. I've had a patient who never smiled, like would never really show their teeth. Even when they spoke, they sort of like minimized how much of their teeth they showed. But now after veneers, they sort of are like
it's
so
magical.
Wide open.
It's magical. And like, I'm going to share with you, I'll send you some of the texts that my patients send me. It's like the nicest things. One of them, she flew in, she's like, I'm a walking antidepressant. I can't stop smiling. And like,
awesome.
that is the best thing, right?
That's
like
so
you're
cool,
able to make people smile. And in return, they're, paying it forward and making other people smile.
Last question, why are people so afraid of the dentist? Like I went to see you. I had a great time. It was a lot of fun. It didn't hurt. We dressed the same.
This podcast is sponsored by Tom Brown.
Yeah.
Not really.
I wish.
Why do we have a bad rep? I mean, I don't know.
Not you personally, but
probably me personally.
Well, the sunscreen, we're going to talk about that later. But
I think dentistry has changed, especially in the last 10 years. I think you used to go in and sit in an old chair.
Yeah.
And there's, weird fluorescent lighting. Like Mariah would never be caught dead there.
No.
Right?
No.
And now we've changed it. You come in, you sit in a comfy chair, you have noise canceling headphones, you're watching TV, you have nitrous. The experience itself is just, elevated and less stressful. And then usually patients used to go in and, you see your dentist twice a year and then you come in and you don't feel anything and suddenly you have a cavity. You're like, what's going on here? And this is why I'm like, come in every 3 months. Let's make sure we're on top of our healthcare prevention instead of reaction, right?
Yeah, actually going to your office, it was so posh. It felt like a place that you want to go.
I love that.
Yeah.
I love that. And this is why our patients never skip their cleanings. They're there. And if sometimes we get double booked and we have to cancel them, they get angry. They're like, no, I want to be there. I want to come. And this is why we're able to establish a rapport with our patients. It's the nicest experience and it's the nicest thing.
Yeah, I think dentistry is a much cooler, more elevated specialty now, which is amazing. Yeah, no. And it's cool that you're all over the world, which shows how, internationally, everyone is thinking about this, right? It's not just a Western ideal, it's sort of like in the Middle East as well. It's like super important.
100%.
Yeah.
And I think a good smile is the new sign of wealth.
Oh, yeah.
And the new sign of status.
Yeah.
I think people want to show that they have a nice smile because it signifies whatever it signifies.
And it's investing in yourself,
Correct.
really. Yeah.
Correct.
Awesome. Thanks so much. Yeah.
Thank you for having me.
Yeah. Thanks so much for listening to this episode of Give Good Face. Subscribe on Apple Podcasts, Spotify, YouTube, and wherever you listen to podcasts. And follow along on social at Dr. Anthony Rossi and at Rossi Durham MD.